Hi everybody, Dr. Bradley Kobstar. For those of you who experience pain, I want to go over with you how to take action to get out of pain without any band-aid or symptom masking drugs that do nothing to actually resolve the underlying problems. These pharmaceuticals create lifelong customers, which is great for them, but it creates all kinds of problems down the road for you. And I know I don't need to go into all the details about the opioid crisis here in America because it's in the news every day. Newspapers, television, it's there, okay? So, there are 3 stages to getting out of pain. I'm going to review 2 stages today, and then the next stage is covered in the next video. Okay, so stage 1 is what I call crisis care. In this stage, the goal is to get you out of pain as quickly as possible. Now, it's important to understand that this phase of care is temporary. The tissues are still weak. They've been damaged, and they have not been strengthened yet, which is when the long-term permanent benefits are going to be realized. So in this phase, we need to be careful because the joints and the muscles are both fragile, they're sensitive, and we can't be aggressive. Okay, so once we complete that stage, now we can move into stage 2. And the goal is to restore mobility, flexibility, elasticity to the tissues. And we can now do that because the pain is reduced, so the inflammation's down, so we can get in and break up any muscle spasm, any scar tissue that restricts your movement. And my program's scientifically proven results speak for themselves. However, I think it's important for you to know that you don't have to live with your pain, or that you have to be dependent on some medication or medical intervention to relieve your pain. Okay, I want to encourage you to take back your life, that you may be allowed to slip away either through self-neglect or maybe you were misguided by some healthcare practitioners who focus on treating symptoms rather than resolving the underlying cause of the problem. Okay? If the medications were going to resolve the problem, you wouldn't have to keep taking them every day. So I'm an ardent researcher, and my rehabilitation program has been published in scientific journals. And after 25 years of this work, I've seen the myths. And if we continue making the same mistakes, life is going to revolve around medications, surgeries, and disability. So I want to remind you that this is a team effort, and you're the focal point of the team. Okay, everyone here at the Wellness Method is focused on your injury and ensuring you get the best results, but you alone are going to determine your level of success. Thanks, see you soon.